Hello, everyone. I'm Cynthia Myers-Morrison, and I'm a board member for Food Addiction Institute. And it is my pleasure to be here with Eva Clemente, who is in London, and Raquel Delgado, who is in Spain. And I am in Tennessee in the United States. So we're all over the world today. So we're here to get a little information about what the story is for each of you, how you came to be a board member for the Food Addiction Institute, and what you're doing on the board, how you are functioning as a board member. And in addition to that, what service has meant to you by serving on the board. What has that brought into your life, and how has it done something in your life? And then your hopes and dreams for food addiction in the world. So with that, here we go. So you please jump in and share, and whichever of you would like to start.
I think Raquel started, because the reason I found food addiction is because Raquel told me about it. So Raquel should talk.
And I was found about food addictions video, which is what we're doing now. We are doing a video for YouTube. I was watching Vera Tarman talking about her Food Junkies book. That's how I came across food addiction. So hello, I'm Raquel Delgado. I'm what is called a GP, or general practitioner, in the UK, a family physician in the US, a general doctor in Spain. Oh no, a family doctor in Spain. And I am, although I'm in Spain at the moment, I work in and live in London, in England. And I have been a practicing GP for more than 20 years. I work for the National Health Service. And then I let Eva do her own introductions. And then I talk a little bit more about how I came across food addiction.
So I'm Eva. I'm a GP, very similar to Raquel. I come from Spain. I've been living in London for now 26 years, which is more than I've been living in Spain. And in my practice, I became interested in diabetes, obesity syndrome in 2010. And I was treating lots of obese patients with type 2 diabetes and other metabolic problems. I came across the low-carb diet, the keto diet, and, I tried to introduce, healthy lifestyle instead of doing insulin and all these drugs. But I became really frustrated because the same patients kept coming on and on and on, and they were doing progress, but then they were going back again into the high carbohydrate diets and putting weights again. And I was really frustrated, and Raquel and I were friends outside work, and we talk a lot about this. And one day Raquel came and said, actually, you know what, I found the missing link. And I thought, you found the missing link? What do you mean? And I thought she was talking about, triathlons or running or something that we do outside work. And she said, no, you need to read this book about, food junkies, about Vera Tarman. And then I actually read it, and I was fascinated. And then I became a food addiction professional. So maybe Raquel can tell us about why she became interested in food addiction instead of diabetes.
My experience is very similar to Eva, but I am involved in the supporting diabetes services in my area. It's an area that covers a population of 350,000 people. So I work closely with the health authorities to support and develop diabetes services for children, adults, and elderly people. And yes, like Eva, I was coming across as well as a GP. We have a large number of people with type 2 diabetes, with obesity, and other metabolic health problems. And I was, like Eva, increasingly frustrated with the lack of answer to these problems from the medical establishment, and kind of like very lost about what treatments or therapeutic approach to implement with these patients. Because yes, we do have a lot of pills and we do have a lot of injections on offer, yet what we had seen is that we're spending millions on these drugs and we're getting very poor outcomes. And patients, although I am a very supporter, like Eva, of the low carbohydrate approach and the keto approach. Like Eva, my experience was very similar, kept on seeing people coming off these diets and lifestyles and going back to the food. So I thought, this is not right. Something is happening here. So a friend of mine said to me, I'm addicted to sugar. And I thought, is that ever possible? And then I started doing some searches on the internet, on Google, and I came across Vera Tarman's video talking about food junkies. And I thought, wow, this is fascinating. This is an eye-opener. This is very different to what I have heard before. And then I spoke to Eva because I was really like, this is the holy grail. I found something. And Eva and I got talking. We thought, gosh, this could be the missing link. This could be the answer to a lot of our queries over the years. And that's how I came across the Food Addiction Institute in Iceland and the training on offer from Esther's school. And Eva, who is a great friend and an enthusiast like me, decided to sign up to the training. And that's been a year later, more than a year later, and we look back, no regrets. I think it's for me, it's been one of the best things I've done in my medical career, to be honest. It's been so rewarding, so interesting, and a massive challenge to what I was already practicing, the medicine I was practicing, and what I was already told by the medical establishment. So it's never too late to open your mind to new things and to try new things. That's what I learned in this journey, and I'm still learning. So that's my experience, and I'll let you Eva do a little bit talking as well. I think it's very similar to mine.
Yeah, I think yeah, the same. After the training, it's opened my eyes to many things. I mean, obviously my patients with addiction are not heart sinkers anymore. You used to see the heroin addicts and the alcoholics and the morbidly obese patients that you can't do anything for, and they stopped being my heart sinkers. In fact, they're one of my favorite now. And then working with people who are struggling with their weights and the past traumas and stuff it's been really rewarding. Nothing compared with when you work on the NHS for 10 minutes each patient, and it's been amazing. And then after a year and a bit working in Resolve Food Addiction, which is our service for food addiction treatment, Esther asked us if we wanted to be part of the Food Addiction Institute, and we were like, I couldn't sleep that night. I was thinking, oh my God, we're going to be sitting with all these people who've been working in addiction for 20 years, and it's been amazing. I mean, we've only started really the work with the Food Addiction Institute. We haven't had time to do it, but we've been trying our best to ask our professional colleagues, and we've been doing some talks. I'm a GP trainer, so I train doctors to become GPs, and we've been moving around in Northwest London to all these training workshops to try to raise awareness, but then hopefully we will have more chance to raise awareness with the help of the Food Addiction Institute. I think that's what my hope is. I don't know what Raquel things we can do.
Really interesting, because some of the people who are on the Food Addiction Institute board, they gave us some lectures, and they taught us during the food addiction counseling training, and to be able to continue to see people like the training being pretty inspirational, because we look up to these people, and I always see them as a very brave bunch of soldiers marching on in spite of all the blocks and the barriers and the opposition and the belief that food addiction is a real issue, and I take great admiration for people who just go against the flow, because they could have given up a long time ago, because it's not recognized that addiction isn't. But instead of giving up on something that they truly believe deserve all this attention, I think it's pretty admirable, that you don't throw the towel in. And my hope, and I think Eva's hope as well, is that this will get some recognition, if not full recognition, in years to come, because what we are seeing in our clinical practice is a tsunami of patients who are really, really struggling to come off addictive food like junk food and consuming large amount of sugar without really fully understanding why they're doing what they're doing. And many people in the healthcare professional are totally unaware that this is an issue. In fact, I would say probably a lot of healthcare professionals themselves do have a lot of food addictions that they are undiagnosed. And I guess if you're an addict yourself, you probably will have problems recognizing the addiction. But food addiction training has not only helped with food addiction. For me, it's like Eva. Now, when I see people who are battling issues with alcohol, drug issues, going shopping, I talk with them in a completely different way. You know, I see things from a completely different perspective. And I now believe that addiction training ought to be mandatory in medical schools, because we do see quite a vast amount of people suffering from addictions in our jobs. We come across many of them, and we see them as, we've been taught to see them as hopeless and helpless, but they're not. You know, I think we are hopeless and helpless as a medical establishment to
Yeah.
our way of practicing medicine. We are very ways.
Yeah, I think the hope is that if food addiction is recognized as a substance addiction, then obviously you will have to add that to the curriculum to medical school. You will have to offer services to treat food addiction in the psychiatric world or the mental health services. So it will become less stigmatized. It will be a bit more like, well, I have this problem and it's just one of those things. You know, now even in the health world, I feel lots of people feel that those patients that are struggling with addiction, any type of addiction, is sort of almost like a choice. They chose to do this instead of doing that. They could have done something else. Well, it's actually, if you start from the beginning, from medical school, to recognize that actually addiction and substance addiction is actually a physiological disease, then, you know, the treatment will improve, and the stigma, you know, is similar to the HIV stigma that we used to have in the 80s. It's now something is almost gone in the Western countries. So, and that's because the treatment and the knowledge and the education is more widely available. So I think if that happens with any addiction, you know, the patients will get the support that they need, whilst now it's almost impossible to get it. I mean, at the moment, I can't send my patients anywhere. I just, you know, you send them to the eating disorders unit, but actually it's not an eating disorder. So it's a limbo there. It's very frustrating. But I think we're on the right path. I think the Food Addiction Institute is doing an amazing job, and we're really hoping to bring lots of our skills and our enthusiasm to the Food Addiction Board, and hopefully in a few years' time we will see things changing. I think that's my hope for the future. Don't know if you have anything else to add, Raquel.
No, I mean, I see food addiction as I saw the low carb movement in the UK a few years ago when I joined, where I've been a diabetes clinical lead working with diabetes services since 2012. And that's when I came across the low carb community that were supporting lifestyle interventions in the way of reducing the amount of refined carbohydrates in your diet as a positive way, as a forward way of managing your type 2 diabetes, rather than taking more pills and rather than going on insulin. And the opposition was massive, huge. You know, the medical establishment, the dietitian association, the diabetes groups wouldn't want to listen to hear about it. It was not a feasible option in their eyes, although we did have, and we do have many low carb practitioners in the UK, not just doctors, but nurses, cardiologists, diabetologists, dietitians. And the opposition was massive when we started talking about low carb or even suggesting low carb. And now it's thankfully becoming more mainstream. It's more heard of, it's more accepted. A lot of practitioners are now thinking about low carb, you know, and offering low carb to their patients. And patients are hearing more and more about low carb. And in a way, I see food addiction following the same trend. No, the more we talk about it, the more people stand up and say, look, this is a problem. What we're doing isn't working because it's not working. Let's look at different ways of managing this problem. Let's see where we are getting it wrong. Let's try to correct it. And I think I'm hopeful, but I'm also an eternal optimistic that in 4 or 5 years' time, we will be in a completely different place. And hopefully, like Eva said, more people will have knowledge of food addiction, not just the healthcare professionals, but also the public. And more people will be coming to seek support and help. And then I think the healthcare professional will not have no choice, as they don't now with low carb, to become better trained and informed and start looking at what services are available to start signposting these people to. That's my dream. I have a dream.
And meet all the food addiction board in person. That would be great.
Yes. So that's how I think it will happen. We are very optimistic that it will happen.
Well, I'm so pleased to have the opportunity to hear the two of you and to hear your hopes and dreams, because I share those. And being able to meet in person, yes, Eva, it was so fun in Bristol. And Esther Helga Gudmundsdottir is the InFact chairperson for that organization. She's been mentioned. Vera Tarman, doctor in Toronto, and Food Junkies certainly has influenced your lives and mine. And such a wonderful testament, and so grateful that you two are board members for Food Addiction Institute and getting this word out. So would you say your Instagram handle or how people can reach you? On the FAI board, there is a place to reach out to board members. So that's one of the ways, but can they find you in other ways? I know Instagram is one of the things I've seen.
Yeah. So we have a website called resolvefoodaddiction.com, and they can go through there to send us an email, or they can go into our website, into our Instagram or Facebook, which is called Resolve Food Addiction as well. And yeah, we're doing lots of education and reels and videos about food addiction. So I'm sure it will come across even if you don't look at us.
Start following.
Yeah, I think what we decided as well, because we speak both Spanish and English. And what we've noticed is there is more and more information out there in English only, and this is a worldwide problem. Is fair enough. I mean, a lot of people are fluent in English, but Spanish is a very, very important language too. I think it's the third most spoken language in the world. And as we all know, obesity, eating disorder problems, type 2 diabetes is not confined only to the English speaking world. Sadly, well, not sadly. I don't want to post out on the English speaking world, but what I'm saying is the worldwide thing. Don't get me wrong. So we felt, Eva and I, that we wanted to spread the word to the Spanish speaking community as well, because we hardly got any books translated into Spanish, not that I've come across. I mean, if you know of any, Cynthia sent it our way. And when I started looking at all resources available, I could not hardly see anything in Spanish being published. And I think it's really, really important that, that we can reach out to in America, it will be the Hispanic community, same with Latin America, but obviously across Europe and other places as well. It's really important that these resources do exist in Spanish. So we do offer our services in both English and Spanish. That's what I was going to say, but I just went on forever.
Yes.
That's fabulous.
Sorry, I do like to talk.
Well, I hope that you keep talking in just this way about food addiction and how the ripple effect through this society will be so substantial. Having the two of you, speaking in Spanish and getting information out into the Spanish-speaking world and English-speaking as well. So thank you for being Food Addiction Institute board members and for putting this information with Resolve Food Addiction. What a wonderful name for your sites and for it's wonderful. So thank you.
Thank you for having us, Cynthia.
Thank you. It's been a pleasure.
Yes, thank you for having us. And probably you go back to bed now because it's very early where you are.
It's early, but I'm up
Yeah.
and working.
I'm going to go for a walk by the beach because I'm in the Canary Islands at the moment, and the weather is
Take me with you, Raquel. Take me with you. Thank you so much, very much. Thank you. Such a pleasure.
Okay.
Thank you.